Good morning. Welcome and good day for the next session in our PEQA Advanced Workshop Series of 2019. As you can see and been looking at the title for our session today, a couple of pieces of information. First, again, if you have technical questions, sound questions, inability to see certain things on the screen, please put that in the chat. We will have a question and answer session after our presentation is completed. However, if a question should occur to you while we are going through the presentation, please feel free to put that in the Q&A box. That way we can differentiate technical questions from content questions. We also at the end will talk about how to obtain CRC credit for this workshop, evaluations on the workshop which are helpful for us, obviously, and we will have some other announcements as well. Without further ado, I'm Terry Donovan with PEQA. Again, we are headquartered at the University of Wisconsin-Stout within the Vocational Rehabilitation Institute. Some of you that may have been on workshops in the past have background as independent consultants and working with Minnesota VR. I was also with the workforce with WinTAC prior to my coming here to Stout to work on Technical Assistance Center work here. Other presenters are Kate Anderson and Tim Tansey. Kate, would you like to say a few words about yourself? Sure. Thank you, Terry. Good morning, everyone. My name is Kate Anderson. Many of you know me already through previous interactions and work, but I have the pleasure of working on the PEQA project, serving as project director and principal investigator. I work for the University of Wisconsin-Madison, but also have the pleasure of continuing work with the Stout Vocational Rehabilitation Institute. Dr. Tim Tansey, our colleague, also works closely with us on PEQA. He was planning to join us today, but unfortunately had an unexpected event that arose. He will not be on the call. But Tim also works closely with Terry and I and other members of the PEQA team on the Advanced Workshop Series specifically. Thank you for joining us. We are looking forward to the discussion today. Great, thanks. What we are going to be doing today is two parts. I'll be covering part one, Kate will cover part two. Some of the pieces and one of the pieces that I thought about and how we are approaching this, and probably because it's an advanced workshop, are different ways of thinking about how to get ready to do your evaluation and incorporating some newer types of approaches that others are practicing. So again, thinking about what your customer promise and the impact, maybe some key value drivers, data that I need to understand if I am delivering on my customer promise. What key operational decisions that you could make if you had your data in hand. And again, part of this goes to, at least for many of us, we do program evaluation, data collection in order to have better decisions, make better decisions, and to understand how the work we are doing is or is not having the effect or impact that we thought it would have or that we expected it to have. The second part, Kate will talk about performance management, logic models, evaluation, quality assurance, and using data to inform stakeholders, but again, bringing the wealth of experience and research background that Kate has to the overall conversation. When I talk about client promise, and there's a fair amount of text on the page, but it's generally coming down to, you can substitute what is your mission, what are we trying to accomplish with clients when they meet with us with a VR. As an example, like you might say, we want high quality VR services provided to eligible persons in order for them to obtain competitive employment. Fairly straightforward. What drives that? What are the values that would underline that? As you think, what is it that we want to have happen? And in some cases, what is the agreement between us and the client that comes? We will do X and the client will do Y. In order to make that promise, one piece is we think, as an example, we would need easy access for clients. We would need a reliable and predictive service for our clients. We think that is a particularly high value driver. You might say rapid service. We may, from some previous evaluation, begin to understand from conversations with our consumers that it was taking too long for them to start service or to get through the application process or to meet up with their community rehab provider. So part of it may be that we want to see a more rapid service. You could say a rapid engagement. Then what kind of data might you need around those value drivers? Again, I've laid out some possibilities, and there will be many, many more that some of you will come up with. We could have that are the observations from our customers and our stakeholders. For many of you, that could be your consumer satisfaction service, and it could be other ways, and I'll mention a couple of other possibilities, and Kate will as well about how to approach that. You may have something like quality assurance scores, or within your quality assurance process, let's say Kate's review, that may be a way that you identify, say, reliable and predictable service might be in terms, or even rapid service may be as you review cases. But as you look at other aspects of quality assurance and elapsed times for different steps in the process, many, if not all, VR programs are routinely looking at how long does it take for people to get through, and what is the average, or what should be the norm. You may want to know what types of service. You may want to begin differentiating. We are very good around these two types of services, but we are not sure about these other types of service. You may want to differentiate. That might be some needed data in this. The other part that is beneficial, I believe, when you are starting looking at program evaluation and looking at your data and the performance measures, what are the decisions that this data will let me make? Beginning to think ahead of time. How are we going to use it? Being as clear as possible. Do we need to improve how clients will access VR? That is a decision we may want to make. Perhaps we find, or we may start trying to determine if we need to provide training or reinforcement to follow some approved standards of service that previously we may have in our organization. Have come up with some specific steps around what we believe would deliver reliable and predictable service. And if we think it's not going quite the way we thought, again, one of the decisions that may help us is a training issue, or is it another issue around that? Then are there changes we may need to make, additional changes we may need to make in the process, so clients can move through the system faster? Again, from at least another perspective about thinking about program evaluation, is starting with what's the promise that we are making for clients. For clients that walk in our front door, what can they reasonably expect? And then how can we go about assessing that? One way to do that, and many of you probably have done process reviews within your organizations around lean process, so this would be similar in some ways. It might be a little easier to do depending on your perspective. What you are talking about in your client journey is you begin by describing each stage of the client's journey through VR, and that can be as few or as many as you would like. And the other part to begin thinking about
in terms of, and part of what we're talking about as we work through this is the whole issue of data collection and the time that it takes for data collection. The 9/11 data collection clearly presented additional time demands and continues to have additional time demands on agencies. But beginning to think what data is collected at each stage, even with the 9/11 data, of all of those data elements, when in fact is that data collected? What parts are collected at each stage? Which in and of itself can begin to give you an idea of are we collecting it at the right point, or is that the best place? Are we overloading certain steps in the process with data collection? Are there options to spread it out? Maybe, maybe not. The other part then to begin to think about is what are the client, and in this case, VR agency touch points? When does the client and the VR staff member actually see each other, actually connect with each other? It could be text, it could be phone, it obviously could be face-to-face. But within the journey, when are there points when contact is made between the client and the VR agency? And again, it can cover the gamut from the counselor or a tech or an administrative support person. So then the the question to think about then with the client journey map, are there touch points where it might make sense to collect an additional impact data, and we'll talk about that a little bit, or to begin collecting certain types of pieces. And some of what this is drawn from some of the international activity that's going on with program evaluation. But again, for organizations who have very little resources or almost no extra available cash, which defines many of the current VR agencies in many ways, have begun experimenting with collecting kind of impact data and evaluation data when they have somebody on the phone or when the client stops by in the office. So rather than a follow-up survey or rather than a follow-up situation, many are looking at when I have the individual in front of me or on the phone or via text or something along those lines, that might be a prime opportunity for me to collect either some of the data that I need or some even additional impact data. So that's part of the piece around beginning to think about touch points. Not advocating this, but just beginning to mention how some are beginning to think about what do we collect. And the other piece that folks are looking at, although for VR there are the 9/11 data requirements, but many organizations are also beginning to think, and that goes to the client promise, what's the absolute minimum amount of data that I have to collect or that I can collect? And there are the constraints of the 9/11, no question about that. But if there are other elements that you're thinking would be beneficial in order for you to answer questions around activities that are occurring, how do you begin to boil that down to the absolute essential questions or information that you believe that you need? And so some of those impact questions that folks are taking a look at have to do with what are some of the core insights from the client about service received. And again, as I've noted, some are beginning, some at least international organizations are looking at ways of how do we collect that information when the client's in front of us. Do we ask them a couple questions right away? And I suspect some of you are probably doing that. It might be interesting to hear if some of you have started to formalize that type of piece. So instead of, let's say, doing the client satisfaction or client engagement after the fact or separately, is that becoming part of a data collection piece, part of an interview, or part of a monthly check-in with a client? I mean, the other, again, as we talk about customer satisfaction and what that could look like, an impact question, and some of this goes back again to tying this information into what is it that we're trying to make happen for clients in our organization. Meaningfulness could be another way of describing, or could be a new piece to think about of what has been the effect of folk rehab on their lives or on their situation. And that may be a piece that comes out in case notes, may come out in other conversations. But do you begin thinking, do we begin asking more concrete pieces about what has been a meaningful to the individual for their participation in VR? It may come out in other ways. Questions around social outcomes. Has there been an improvement in the individual's general income level? And some of that may or may not show up in the 9/11 data. Is it helpful to understand that the quality of life is improving because of services from vocational rehabilitation? And again, many of you have been in this way longer than I have. I've been in it for probably about 10 years now at various points. And in some ways, we may get locked into, again, just the data and just what that's looking like. Stepping back, and some of you may have done these pieces again already. What in a broad sense is the social impact of all of the VR services that are being applied to the individual? I mean, employment is the outcome, but performance measures and those. But what is, if my median income does go up, what's the social outcome of that? What's the impact perhaps to me? What is the impact to me in terms of my feelings, my sense of self-esteem, my sense of worth? How might that be spreading through the family? And how is that having a greater outcome, a greater impact over and above just the fact of employment? Again, the impact questions on employment, but perhaps looking at wages. Marketing, and from this standpoint, how are you getting people? And it goes back to the question of easy access. And sometimes that is a marketing question. How do we help clients understand what it is, what it looks like, the easy access piece? One of the other technical assistance centers that Kate and I are involved with is the targeted communities, and one of those within that is a piece that we are trying to discern for individuals living in extreme poverty and with disabilities. What might be some of the barriers, and how can we better help people understand that VR is there, VR is available, and would like to be of service to them. So those are some of the other impact questions. How are you getting people to come to you and request service? Understanding waiting lists, understanding those types of things, but what's the understanding? And then the question of customer personas, and some of that ties a little bit in with the meaningfulness. What are some of the hopes and dreams that people have had? How do you believe VR will impact how a person overall feels about themselves after finding a job, after getting additional skills, after working for a period of time, after getting a promotion after a period of time? How is that beginning to affect both individual clients, and conceivably what does the mix look like that we're after? And some of that can come back to, are there certain types of clients, certain parts of your state, certain types of disabilities that you believe may be underrepresented in VR, and you'd like to get a broader mix of that? So again, after you've thought through some impact questions, then what kind of data do I have? And we talked about, we have 9/11 data, we have the common performance measures. You can take a look at this. It's just, what data do I have, which then can lead to the follow-up question of, then how do I use the data that I have to help me answer some of the questions that may come up? And so with the 9/11 data and some of the categories that I've introduced, within meaningfulness, you can if you opt to take kind of this general approach, the 9/11 data, among other things, can clearly help you with the types of services that are being used or referred or suggested to a client, and the frequency of how that's occurring. And the 9/11 data can also help you with progression through VR. I mean, these pieces, but it is. In the past, probably before not for everyone, but in many ways, the advent of the performance measures, quarterly reporting, and the monitoring has increased the potential and the actual usefulness of the 9/11 data to help programs understand what's happening within their program. The marketing, if depending on, again, how that information is collected within the 9/11, you have referral sources to and from. You may start looking at, and I know it has come up at different times, beginning to look at our CRP sort of successes, who seems to be within our CRPs, and being able to use your 9/11 data to let you know generally that some CRPs, and you probably know this, many of you would know it just from observation, who seems to do better? Which ones of our CRPs seem to do better in finding employment, helping people gain employment, helping people retain and stay in employment compared to others? And how might that affect how you allocate resources as much as you can? And then, just as I talked about the issue of customer personas, you have the slew, the large quantity of client descriptors and background information that are currently available in the 9/11, as well as beginning to collect both at interview on what is the background, as an example, the low income question that's on the 9/11 pieces, and then the requests, and when cases close out, what was the wage when the individual left, and then beginning to look within the performance measures of the median income, second quarter after exit, median earnings, second quarter after exit. But beginning to give you an idea then of what do our customers look like, and how are our customers changing? Are we when we had a target in mind for what we would like to see for a mix and a progression and an impact, The 9/11 data can help you do that, clearly. And within social outcomes, at least around the performance measures, I would suggest, particularly around social incomes, things like the measurable skills gains and the credential rate. I mean, one of the underlying reasons of WIOA and has been tracked it's now being tracked by VR and tracked by labor for a number of years, that it was believed, excuse me, and we'll find out, if increasing the skill level of our clients, of our VR clients, and increasing the rate of recognized credentials among VR clients should improve the likelihood of employment, and conceivably would improve the likelihood of sustained employment. That, I think, can be viewed as, those can be viewed as indicators and sort of steps in the process to a good social outcome for a client of increasing their skill level, increasing ideally their confidence, adding things like recognized credentials that then are transferable, which gives the individual ideally greater flexibility both in its original job search and an ongoing employment and career development. And then the whole question of employment, second and fourth quarter after exit, second quarter median earnings. But I mean, it goes without saying, and that will help employment, and that will begin to give you an idea of the impact, which has been one of the key elements of the new common performance measures. So then you go out and you collect your data, and as we noted earlier, what additional data do you need? You've looked at your client journey, you've looked at touch points, you have current 9/11 data, many if not all of you have customer satisfaction, you've been doing needs assessments, or many of you have begun or are partway through or are finishing up your comprehensive statewide needs assessments. So there is a vast amount of data. There may not be any additional data that you need, but if there is, based on the impact that you're trying to achieve, some of the newer pieces, which technology is best for collecting data? So that, I think, is always a good question to ask as you're collecting data around program evaluations. How do we collect our data? Is it a face-to-face? Do we begin using something like texting, surveys on cell phones for clients? The huge penetration of cell phones within the U.S. population, and some of the response rates that are starting to be collected for surveys that people receive on phone can be 2 to 3 times higher than an email survey, and for sure a mail survey. Do you want to do phone calls to individuals to collect it, or do you do surveys, as we noted, email or other types of surveys? So with that, I will turn it over to Kate, who will cover the second half of our presentation. So Kate, it is yours.
Great, thank you, Terry. So the second half of today's presentation, I'm just going to continue to build upon the foundation that Terry provided during the first half. And then our goal is to leave plenty of time for questions and answers at the end. And any questions that we don't get to today, we will have a running document and we will compile those, provide the answers in writing to everyone following the presentation. So thank you, Terry. So as Terry had noted, there are multiple methods through which you can gather data, etc. But within our programs, particularly within our state VR programs, having the data is wonderful, but we want to consider the data to be living and dynamic. So one of the worst things we could do would be just to simply gather the data for compliance purposes and spit it out into a report going to a limited audience. Really, we want to have the data coming in through multiple formats, multiple modalities, and then using that data on a regular basis to help generate the knowledge. And I still haven't done this, but I'm determined at some point to get buttons or pins made that say data is our friend. Really, data doesn't need to be scary. It shouldn't be reviewed in a vacuum. In fact, you want multiple stakeholders to be inputting data into your systems and then also having access to the access to information coming out. So certainly understanding that we need to have proper protections and security measures in place to protect our data, but then what do we do with it to essentially transfer or transition it into knowledge in usable formats so that it can be put into action to help us not only monitor our programs, but to continually improve our programs and enhance our outcomes and impact. And Terry, I'm not able to, oh, there we go, sorry. There's a little delay with my screen advance. So for those of you that are already familiar with this document, great. But for those of you that are not familiar with the Institute on Rehabilitation Issues, the 36th IRI, we strongly encourage you to look at this. The IRI was funded through the Rehabilitation Services Administration, and the 36th IRI was coordinated and published by our colleagues at the University of Arkansas through their Currents program. The 36th IRI really focuses on performance management with an emphasis on program evaluation and quality assurance in vocational rehabilitation. It came out in 2011, but really it still serves as a strong foundational document. So if you haven't seen it yet, we recommend that you honestly can Google it to find it. Or we could make that available as well following the webinar today. But we pulled this quote out of the 36th IRI. I love it. Vision without measurement is just dreaming. And measurement without vision is just wasted effort. So you really need to have both the vision in terms of what do you want to achieve, where do you want to go, as well as the measurement to be able to measure progress, as well as the outcomes and impact, so that you have clear data to demonstrate when you've achieved your goal. And this next slide, the performance management, again, we borrowed this graphic from the IRI, but I think it does a beautiful job of illustrating the components involved in performance management. So when we talk about performance management, really it's not one static thing, but again, performance management should be active and dynamic. And there are really two core components of performance management. First of which is program evaluation. And program evaluation focuses specifically on acquiring the data and the metrics associated with measures, analyzing the data and reporting results so that you can use the data to make decisions about policy, practice, service delivery, etc. So within program evaluation, really it involves the components of designing your evaluation. What data do you need to collect? How are you going to gather it? What are you hoping to learn? Some common questions in the design phase involve, are we serving our customers in the best way possible? Are we meeting our standards? Are we going beyond compliance and really looking at a more involved, comprehensive system? And then also, how can we encourage innovation and yet develop measures of accountability? So within our programs, how do we encourage and empower our staff to think creatively and continue to innovate while still having accountability, appropriate accountability measures within our programs? And that could apply to our vendors and service provider partners as well. So design. Data collection, how are we gathering our data? And Terry mentioned a couple of the techniques that we've been finding to be particularly helpful in terms of touch points with the consumers, texting, etc. Another element to consider during the data collection phase is cultural responsiveness. So are our methods really designed in a culturally responsive manner? Terry had alluded to the fact that many of the individuals that we're now serving in our in our public VR programs are living at or below the federal poverty level. Many are also living, experiencing multi-generational poverty, which is, from a cultural perspective, has different considerations than individuals that may be experiencing middle class status. So really ensuring that we have a culturally responsive approach for evaluation. Data analysis. So once we have the data, what does it tell us? And utilizing some of the rapid cycle evaluation approaches so that we don't just gather data, let it sit there, let it build up, and then work with it all at once. It's good to work with our data on a regular basis so that we have a sense of what is going on point in time. And then, of course, reporting the results. And that you may need to report differently to different stakeholder groups. The type of report and the formatting that you share with the legislators might look different than the way that you need to report data to your state rehab council, which may look different from the reporting that you provide to RSA. Now, granted, the data should be consistent and it needs to be accurate, but you might need to change the formatting across audiences. So then the second core component involved in performance management is quality assurance. And again, that's looking at the quality of the data. So you could have a lot of data in your system, and I know that many of you are actively working on this in your programs. You want the data in there, but what does the data tell you? Is it meaningful? Is it accurate? And now with the WIOA data elements, many of the programs that we work with are becoming more familiar with the data and are actively working on improving the quality of the data in their systems, which is great. Again, ensuring standards of quality have met, corrective actions, and I know that that can have a negative connotation, but really we like to think of corrective action as a positive, proactive measure. So you don't need to be reactive in terms of looking at the quality. Again, if you're looking at your data on a regular basis, you can pick up on patterns or trends and be able to address those rather quickly. It's also a wonderful opportunity for administrators to to work directly with counselors and staff in the field to find out why there might be gaps in the data, or if there are inconsistencies, what's going on. Oftentimes it's the field staff that can provide the best input in terms of how data, what's going on with your data. So we really encourage you to engage folks in the discussion. And then evaluation of the actions taken. And again, this does not need to be viewed as a negative component, but really in terms of corrective actions, what's going on with our data? What does it look like? Is there anything that we need to change? And then just that follow-up, closing the loop, circling back to ensure that we're looking at it again to see if the change did happen. So overall, the goal with performance management is really continuous improvement through systematic and constructive action. So really a dynamic kind of living process, if you will. And you need to have both program evaluation and the quality assurance elements in place to have a truly comprehensive performance management approach. Some of the key questions that you may have during your performance management process would be, what are the goals or outcomes? What do you want to achieve? Who are the stakeholders that should be involved? And Terry had mentioned some stakeholder groups earlier, but certainly consumers, families, service providers, staff within the VR organization, in terms of field staff and field staff, counselors, management, administrators. It can be helpful to get information across multiple levels or tiers within an organization. What information do you need? And oftentimes it will be the stakeholders that help you identify what information is needed. And again, remembering that culturally responsive evaluation can be tremendously helpful in terms of identifying what information is needed. How do we measure progress and outcomes? So once we identify the questions, the goals and outcomes, who needs to be involved, what information do we need to gather, then how do we measure our progress so that we know when we're achieving our goals, and or if we're falling behind a little bit on achieving our goals, what's going on that's preventing us from moving forward as quickly as we'd like to. We also need to define success, because again, if we are only measuring but we don't have that vision, or if we only have the vision and we don't have the measurement, we really don't know how to adequately define success. When and how are the measurements presented? To whom should the measurements be provided? Those are key questions. Again, back to multiple stakeholder groups, multiple audiences, and being attentive to the varying needs. And then finally, what is our baseline? So where are we starting, and then where do we want to get to? Some of you may be familiar with the Baldrige Program, and or you may be Baldrige recipients yourselves. The Baldrige Program at the University of Wisconsin-Stout is a Baldrige site. And for those of you that may not be familiar with Baldrige, Baldrige is a national quality program on performance excellence. So it really is a comprehensive, structured approach to performance. We use the term performance excellence, but also which encompasses performance management. It was established by the federal government in the late 1980s, and really is designed to enhance the competitiveness, quality, and productivity of organizations within the United States. They have different groups that they focus on, kind of tailored to three specific areas. One is business and nonprofits, the second is education, and the third is healthcare. But within the Baldrige, and technically it's a quality award, but within the Baldrige structure for performance excellence, they have 7 key categories for measuring performance excellence. The first of which is leadership, also strategic planning, customer focus. So you always need to include that customer focus. Who are we serving? Are we achieving what we need to achieve in terms of outcomes, success, and high quality service delivery? The fourth area is measurement, analysis, and knowledge management. The fifth is the workforce focus. Sixth, process management. And then finally, the seventh is results. So if you're interested, this is just really an introduction to Baldrige as one example of performance excellence program. We provided the link, and you are very welcome to check on it. They have, it's a full continuum. So to become Baldrige, there's a full process and fees involved. However, the website has many excellent resources available that are free of charge, available to the general public, and you can just download them and put them into practice in your organization as you see fit. When it comes to performance management, of course, we have performance measures. I'm not going to spend too much time on this, but when we think of performance measures, there are multiple phases. So we have process measures, progress measures, and outcomes. Oftentimes we refer to this as either formative evaluation or summative evaluation. So formative is really focusing on the process, and then the summative is outcomes. So are we meeting our objectives? And there we go, thanks. So we have some information today on logic models and how this fits into program evaluation. So we're not doing a deep dive into logic models, but if you're interested in more information on this, we are happy to provide it. We have monthly discussion sessions. Terry typically facilitates these and does a wonderful job. I'm happy to join for future discussions if you think it'd be helpful to work through logic modeling specific to vocational rehab in the near future. Logic models, if you haven't had an opportunity to work with logic models yet, you're in luck because they're coming. They're picking up in popularity, and they actually fit really nicely with strong program evaluation models. Really a logic model, to put it, oops, can you go back one slide, please? Thank you. Yeah, so the basic logic model that we have here is a linear process. Logic models don't have to be designed as a linear process, but really the goal with a logic model is to have, essentially develop a picture of how your organization does its work. So based on the theory and assumptions in a program, it ties in the resources and inputs, the activities or action items, the outputs, so what are you actually producing or delivering that then contribute to the outcomes and impact. So as you're looking at this slide, the first two steps are really the planned work, which will then ideally then lead into the intended results. And the way a logic model, this particular logic model is laid out and formatted, it's really a series of if-then statements. So if we have the proper resources and inputs, then we will be able to conduct the activities. And if we conduct the activities, then we will be able to produce the outputs. If we have the outputs, then that will lead into the outcomes, etc. And many of you may be familiar with the Kellogg Foundation, but if not, we've included the link here. The Kellogg Foundation really has a wonderful repository of strong program evaluation resources and materials, and they also have a specific guide for developing logic models, which we've found to be very helpful. This is all available on their website openly, and so again, you can just click on that link. If you find the information helpful, you can take it and use it. What I really like about the Kellogg Foundation materials is that they're designed, they can be used by anyone. So we know researchers that are using these resources, and we also know many program administrators, policy staff, and practitioners that are using the materials. So they're really designed in a user-friendly fashion that any of us can take and put into action in our agencies. Okay, next slide, thank you. So when you're reading a logic model, again, there are some, this is kind of a fairly basic logic model, but it's designed, the resources and inputs are really, the question is designed as what do you need to accomplish your activities? What resources do you need to have in there? That includes financial resources, staff, space. It may include community members or service providers, transportation, etc. Then moving into the second step, which are the activities, the underlying question are, assuming you have the resources and inputs, what activities do you need to conduct? Activities could include training, data collection, as Terry was noting, the touch points. How do we want to collect the data? What is the most effective? Which then leads into our outputs, the underlying question, what evidence of service delivery is there? Outputs examples include, again, service deliveries, but also service delivery, but it may also be more administrative items, such as reports or reports to multiple stakeholder groups. When it comes to outcomes, this particular illustration it just has one box for outcomes. You really can split this into two if you'd like to, which are the shorter term outcomes, which are designed around what specific changes do we hope to see in program participants' behavior, knowledge, skills, and status and level of functioning based on the activities that are provided and outputs that are provided. So typically short-term outcomes should be attainable within a 1 to 3 year time frame, whereas longer term outcomes are typically achievable within a 4 to 6 year time frame. So this is one of the things that I think it's an important point, in that many of our programs we expect to see outcomes immediately. I think it's probably better when you can split those out in terms of more immediate outcomes. You'd like to see those in the shorter term outcome box, 1 to 3 years. Others may just take time, so 4 to 6 years. And then ultimately the impact, which is kind of those fundamental changes that we want to occur within our organizations, communities, or kind of more of the systems change work. Really, we can't expect that immediately. That takes place over a 7 to 10 year time frame. And so oftentimes within the work that Terry and Tim and I are involved with, grants and demonstration projects and whatnot, we don't see the impact immediately. Sometimes the impact takes, if we're effective, we will see the impact beyond the scope of our funding for projects. So, however, within state organizations, you may have a better ability to see some of that impact longer term if you're actively working with your data and you have a solid performance management approach in place with the evaluation component. Next slide, please. This is an example logic model. I'm not going to run through it today. This one is again, an excerpt from the Kellogg guide. But this provides an example of a logic model that's geared more towards healthcare. Again, through a discussion session, we'd be happy to run through development of a logic models more specific to vocational rehab if folks think that would be helpful. Why use logic models in evaluation? First and foremost, good evaluation reflects clear thinking and responsible program management. It really just provides a nice roadmap, something that's very clear for folks to be able to take and use and understand what are you hoping to achieve and how are you going to get there. It also serves as a visual representation of how the program is intended to work. And this is something that everyone, all stakeholders involved can have a copy of it. Typically, we like to see logic models that are one page. If you can get it onto one page, that tends to be the most effective. 1 to 2 pages works pretty well as well. But logic models also connect program resources and activities with the outcomes in a comprehensible document, which can be very helpful to share, particularly with legislators and administrators. Logic models are also, they also help identify outcomes and help anticipate ways to measure them. And then again, it provides one universal roadmap for all stakeholders to have and to use in achieving the goals of the program. The other piece that we didn't get into much here today, but when developing a logic model, it's really helpful to get input across stakeholder groups. And then you end up, number one, with a stronger logic model that is probably going to more accurately reflect what needs to be done in terms of achieving the goals. And then also, too, you get buy-in from multiple stakeholder groups, which can be much more effective in achieving the outcomes. Using evaluation data, Terry had touched on much of this earlier, but really when you have this comprehensive about performance management package involving your program evaluation and quality assurance, you want to use your evaluation data on a regular basis. Again, don't let it sit there and or have just 1 or 2 people looking at it on a regular basis. You really want to be able to integrate it into the culture of your organization. Using your eval data to modify the program and improve service delivery. So kind of that, again, considered a living entity. Using your data for planning. Also providing information, both quantitative and qualitative, to legislators and other stakeholder groups. It can help you identify some of the capacity building needs that might be taking place. And again, these may change over time. Recognizing stakeholders, because you may also have some stakeholders or vendors that are doing a really fantastic job, and that could come through very clearly in your data. So it's not just don't think of the data as a gotcha. Really think of the data as an opportunity for you to understand what's going on in your program at a deeper level. It also helps you identify professional development opportunities, both internally as well as with other stakeholder groups. Using it to monitor and improve programs, and then of course using it to help inform a wide variety of stakeholders, including consumers, advocates, councils, service providers, and the general public about your program. And one of the things, I hate to say it, but over the years we continue to say that the public vocational rehab program is one of the best kept secrets, and we don't want to be. So use your data to help tell your story. And finally, again, just to reiterate, keeping stakeholders informed and involved is critical, and keeping legislators informed is critical. So every program needs to have the elevator speech, which is that short message with a big impact, which helps us demystify the public voc rehab program. So what is your program? Use your data to help illustrate your successes and your outcomes. And also then again, using that knowledge translation. So using your data, but then making that available to help illustrate, again, your successes in different formats for different audiences, and get that information out there. We want people to know how successful you are in your work. We want people to know the complexity of your caseload. That's all good information that you want to have available. And Terry, I think with that, oh, yep, and then use it for future planning, because as we all know, the only constant in life is change. And so even though the logic model that we shared today was designed in a linear format, really we know that these things are circular. So as soon as you complete one project or achieve one goal, you probably have multiple other projects and goals in the works. So we're happy to share more on that at a future date.
Thanks, Kate. And so we have time for some questions. I think Jen has been kind of keeping track of some questions. If you wanted to, so Jen, if you'd like to read a question that someone may have asked us.
Sure.
We've got 2 or 3, I think, before we're done.
Sure, sounds good. One that came through is, what are some strategies to get other staff interested in evaluation?
Maybe Kate, you want to talk about that one first?
Sure. So the question is, what are some strategies to get, was it other staff involved?
Yes.
Yes, I believe so.
Sure. And so in terms of other staff, I'm assuming that could be within the public vocational rehabilitation program. But there are many strategies, but just a couple that come to mind immediately. With your comprehensive statewide needs assessment, make sure that you are actively gathering input from staff within your agency across a variety of roles and responsibilities. I think that's important. You could do that quantitatively through surveys, or you can do it through interviews, internal focus groups. Another method that we're seeing gain in popularity are data parties. I know, and if you're not an evaluator, you probably think data parties. That doesn't sound like a party, but it's an opportunity to essentially have your own smaller kind of community of practice around program evaluation and quality assurance within your agency. And you meet on a regular basis, and you just bring in questions, comments, challenges, or you do a data poll and you look at it and work through it together and say, what is this telling us? What are our questions? What is this telling us? How does it look? And it provides an opportunity for more people within the organization to become involved with the data and familiar with the data, so that again, data is your friend. Data doesn't need to be scary. Harry, do you have any other suggestions?
One other piece sometimes that I've heard from a couple evaluators in some VR agencies, they have started creating reports that they think people should know, and they've started sending that around to supervisors or managers, generally using the 9/11 data, but more than just counts, maybe some interpretation or some zip code differentiation. And they've reported back that that seems to be getting interest of folks that, oh, this is more than just counts. Now I'm beginning to understand why I enter gobs and gobs of information. And so for some, they're, instead of waiting for people to come to them, they're sort of pushing the data out to others over and above, say, some standard reports. That's what I've heard from folks.
Yeah, actually, Terry, that reminded me too, there's, along those lines too, data visualization can be really great. So within your organizations, you probably have a variety of different case management software packages that you're using. But data dashboards can be really helpful. You know, pictures worth 1,000 words, as we say, right? So being able to provide kind of more point in time data through data dashboards or visual reports rather than sending things out in longer narrative format can be helpful.
Good. Thanks, Kate. I notice we've got about 4 minutes left, and we don't want to keep you past the hour that you signed up for. So, Jen, can you give a synopsis or description of how people can get their CRC credits if they would like, the evaluations, and any other announcements that you think would be good?
Sure. First of all, I would like to talk about the capstone projects. We encourage you all to take a look at the capstone projects available on the PequaTac website under Visit the Capstone Project Hub. After successful completion of the online PequaTac certification courses, participants implement a capstone project within their state VR program. We have Margaret Aylwine from South Carolina, project titled Comprehensive Needs Assessment for Pre-Employment Transition Services. Eve Lowe from Minnesota, project titled A Pilot Study Evaluating the Effectiveness of Person-Centered Planning. And David Higginbotham from Louisiana, project titled Motivational Interviewing, Training, Effect, and Vocational Rehabilitation. And we hope you take a moment to look at these. And I just added the link to access these in today's chat box. If you haven't done so already, we also encourage you to visit the 2019 Summit Conference website. And I'll add that link as well to the chat box. This year's conference is in Portland, Maine, from September 4th through the 6th at the Holiday Inn by the Bay. And there is an early bird discount available until July 15th. And lastly, today's webinar is worth 1 CRC. An email is going out tomorrow with an evaluation link where you may request the CRC. You will be able to find the archived version of this webinar on the PequaTac website at pequatac.org, as well as our YouTube channel. Thank you for joining us today, and we hope you enjoyed the webinar.
Great. Thanks, Jen. And any closing comments, Kate?
None other than just to thank everyone for taking time out of their busy schedules to join us today. In the evaluation, please, if you have other topics or other information that you would like us to engage in the future, we are happy to spin out as many webinars and or discussions as would be helpful. So feel free to send us your input.
And I'll note on the CRC piece as well, and Jen mentioned that this will be archived. We also have some previous webinars that we did, the VR evaluation coach with Todd Honeycutt and Purvi Savak. And then Todd also, I believe in January, had a presentation on using pivot tables to analyze data, and he used some examples around pre-employment transition services. So those, again, are archived on our PequaTac website and could be available for you if you need a couple extra CRC credits as a deadline may come down for having a requisite number of credits that you need. So with that, thank you everybody for joining us, and we are done for today. Bye-bye.